Thank you so much, Kelly, for being here. It is such a delight to be able to talk to you. I am eager to hear your story.
I do have a story to tell.
Oh, I'm so excited. I'm so excited. Okay, well, let's get started. First, tell me when this infertility journey started for you. How old were you? And if you remember, how did you know or when did you know that you needed help?
So I guess my infertility journey really started back when I was 15 years old. I'm 34 now. Well, turning 34 tomorrow, actually.
Oh, happy birthday.
Yeah. So back when I was 15, I was having a lot of pain in my abdomen, and my menstrual cycles, I noticed were abnormally painful. All of
Okay.
my friends, like, they never really complained about having such severe pain during their menstruation. So, like, I went to my mom. I'm like, I don't think something is right. Like, I was doubled over in pain, like, could not function when I had my menstrual. So she had me go to the doctor, and I was diagnosed with a huge cyst on my ovary when I
Mm,
was 15. So, and I was explaining my symptoms, and the doctor had said that I might possibly have something called endometriosis. And at that time, like, being a 15-year-old, like, I had no idea what that even meant. I remember, like, I just started bawling because he's like, I see this cyst on your ovary. And he was like very nonchalant about it. But, when, like, I'm 15, I have no knowledge of
right.
anything that could be going on. So he's like, it's big enough where we need to schedule you for a surgery to get this cyst removed. So I went in for the surgery like 2 weeks later, and I was waking up from the anesthesia. And I remember the doctor saying, you have endometriosis. And at that point, I believe it was stage one or stage two. I can't remember exactly. Ignore my dog coming down the steps to see if
No
no
worries.
um, so he said, you have endometriosis. So he said, we'll talk at your follow-up appointment, really what that means. And that, from then on, kind of set the foundation for my infertility journey. So I had the follow-up, and he said, there really is no cure for endometriosis. There's things we can do to help kind of keep it at bay, but there is no cure. And unfortunately, you're going to have to kind of navigate through this for and as long as you have your menstrual. And even at 15, he started talking to me about the chances that I could possibly have infertility.
Mm.
So he had said, with this diagnosis, you really shouldn't wait past 25 to start having a family. So, I'm
Wow.
15, like, that was really only 10 years away. And luckily, like, I had been with my husband since I was 14. I didn't know that I would be with him now. We're still married now. We just celebrated our 14-year wedding anniversary. So
Happy
thank
anniversary.
you. So, I had gone to him and I said, I know, we're only 15, and this is, like, we're so young, but this is what the doctor's telling me. I just want to put it
Mhm.
out there, so we can start thinking about this later if, our relationship goes that way. So over the next, several years, I stayed with my husband. We had gotten married pretty young. I was 2 days before my 20th birthday. We had gotten married, and pretty much like right away, we had started to try to have a family. I had this, endometriosis diagnosis in the back of my mind, and I really didn't want to wait. I was just finishing up nursing school. We had just bought a house,
Mm.
and I said, you know what, let's just try. So we started trying right after we got married, and nothing was happening. Month after month, nothing was happening. And I just remember, like, having these false expectations that, I was going to try. And despite what my doctor said, like, I was going to get pregnant right away. And it was just like letdown after letdown after letdown. And, like, all through my 20s, I struggled. Infertility took me to such a dark place in my life. Like, looking back, I infertility warriors, like, we truly are warriors. Like, looking back at what I had gone through in my 20s, and I did it alone. Like, that was
Mm.
that was the hardest part. I knew nobody struggling with infertility. I had no outlet, like nobody really understood what I was going through, and that disappointment that you feel when you see that negative test month after month and you just have this burning desire to have a baby. So I didn't know where to turn. I had nowhere to go. And unfortunately, I did end up, like I said, being in a really dark place, and I developed an addiction to pain medication. I was on
Mm.
pain medication since I was a teenager for this endometriosis because it was that bad. And I almost gave up in a sense. I just, I realized that, well, I thought at that time that I would never be a mother. I didn't feel that life was really worth living because I didn't see an out to it. I could not imagine myself being a mom. And I started to give up.
Mm.
Um, and I didn't know that there was help back then, and I'm an RN by background, and I just didn't realize that there was infertility help. Um, and at that time, my husband and I, we were living a very modest lifestyle. Like we were just barely making ends meet, really living paycheck to paycheck. And I didn't really think that we could afford fertility treatments. So that was, another factor that contributed to my overall depression. And then late in my 20s, I kind of woke up and realized I need to do something. I was addicted to pain medication. I was extremely depressed. Like I said, I had no support. I didn't know who to talk to. So I ended up entering myself into rehab, and I found Jesus shortly after that. And I really feel like he delivered me from that time of my life. Like he truly saved me. And once I started, really surrendering myself and realizing that I couldn't do this on my own. I couldn't fight this journey on my own. And I started putting all of my faith and my trust into him and leaning on him to get me through. It was just like blessing after blessing. Like everything started falling into place. My career flourished, my husband's career flourished. Financially, we were able to seek help and go through fertility treatments. And it was still a long journey. I mean, we didn't have immediate success. It took a long
Yeah.
time.
Yeah.
Um,
Well, just a moment. I mean, you said so many amazing things. I think it's so great that you didn't skip over that dark period in your life, because there are a lot of women who are going through a dark period in their life and they don't know where to turn. And for you to be able to admit yourself, to get treatment, first of all, kudos to you. That's huge. There's a lot of women who have a hard time getting out of that place.
yeah.
And then to find Jesus and allow him to completely change you from the inside out is a whole nother thing. So I just want to commend you, and I just want to
Yeah.
put that out there. And I think that that's so wonderful. It's amazing when you give him your all, how you release that control to him, and he's like, okay, thank you, finally.
Yeah,
I
exactly.
love that.
Yeah.
All right. So you were at a place where you
Yep.
financially could. He provided a way where you could pursue fertility treatments.
Yep.
So tell me, what procedures, surgeries that helped with endometriosis? Did you like the specialists that you went to? All of that.
So I was really naive, and I didn't have a lot of knowledge about the, infertility world, reproductive endocrinology, embryology. I didn't know anything. Even though I was a nurse, I didn't know anything. So literally, I might as well have just closed my eyes and blindly picked an RE. I really I didn't know who. I was just like, oh, this one's in my area. I'm just gonna go to this
Yeah.
one. So I initially started off with a clinic, and I didn't have any experience to reference to, but I knew right away that it probably wasn't the best fit for me. My doctor, he was good, he was thorough, but I just felt like he kind of downplayed everything, and he downplayed my concerns. So, but I still went through a cycle with him. And I remember going into that, I did 5 transfers total. So
Mm,
I did two, I did 3 with him and then 2 with a different reproductive endocrinologist. So I just remember like going into it and being like so scared, but seeing, sorry, my
you're
son's in
fine.
the background. um, just like being so scared, but being like so hopeful at the same time. And I had really high hopes that it was going to work the first time.
Yeah.
Um, as far as like procedures and tests, so he was, like I said, he was very thorough. I had a full like gamut of blood work. I had an HSG, so they checked my fallopian tubes. I had a previous surgery for my endometriosis several years back, and my one fallopian tube was blocked, but I had an HSG, and my tube actually like miraculously opened. So both of my tubes were
Awesome.
open at that point. Um, but he did like the normal, hormone checks and checked my thyroid and see if there were any like metabolic disorders and things like that. And everything honestly was coming back okay, except for this, stage 1, stage 2 endometriosis. So I didn't really receive a fertility, like an infertility diagnosis per se, because my endometriosis wasn't really that advanced. I mean, it goes up to stage 4. I had like stage 1, stage 2.
Okay.
So we did our first egg retrieval and did a fresh transfer with that egg retrieval. And at that point, I think I was 29 or 30. So, I mean, I was still like in his eyes, on the younger side. We did not do genetic testing. At that point, even though I knew that was an option, he said he didn't feel we needed to do that because of my age, even though at that point I had already been trying for like 9, 10 years. Um,
Gosh.
but he recommended against that at first, which that was like red flag number 1. Like I really wanted to do that and he wasn't really listening to me. I really wanted to do that because I just had like this, I just knew that something wasn't right.
There's so many girls that I talk to where it's like that gut
Yeah.
feeling,
Mhm.
and it's like you got to trust that. It's there for a reason.
Yeah, exactly. Yep. So we did our fresh transfer. That was transfer number 1, and
Okay.
that did not work. I had a stark negative test,
Mhm.
did not take at all. And then that was going into like a new year. So there was actually several months in between our transfers. And then we were gearing up. We only ended up getting 2 embryos from that egg retrieval. We only had 2. And for my age, like I really probably should have had more, but we only ended up getting 2. So
So how many were collected in total?
I had 10 eggs collected and then
Okay.
9 fertilized. And then by day 5 or 6, I ended up
Mhm.
having 2 embryos.
Okay. Okay.
So we did another frozen embryo transfer, and I just remember like in between that, after my first failed transfer, like my very first transfer, I started like that fire started to go out a little bit, and I started to think to myself like, this literally is never gonna work. Like there's no way, like it's never gonna work. I just had my hopes up so high that I was gonna have to do it once, and that's it, and it was gonna
Which
work.
is That's totally normal.
Yeah.
I
Yeah.
mean, if only IVF worked every time, that would be amazing.
Exactly. So we did our second, and that was our final embryo from that egg retrieval. Did our second
Mhm.
transfer, and again, nothing. Not even a stick. Not a chemical pregnancy. Not anything. Just a stark negative. So at that point, my husband and I were really at a crossroads. We didn't know what to do. We had literally scraped and scrounged and saved
Mm.
every penny that we could to afford to do IVF. And now we had 2 embryos that failed and didn't
Okay.
work. So we actually I don't want to say that we gave up, but we started exploring other options at that point. We were looking into fostering. We felt really called to do that, to foster, because, like we were praying and we're like, is this a sign, that God wants us to save another child? Maybe that's why we can't have our own, because he wants us to save another child and give all this love that we have to another child. And I think that that
Right.
might still be like later in our future. I don't know what the plan is,
Mhm.
but so we started exploring that, and we were actively going through that process. And that's a pretty lengthy process to become a foster parent.
Yes.
And then my RE called me and he said, my clinic is starting a clinical trial with a new
No
medication.
way.
Yeah, a new medication, significantly discounted rates to do IVF. Like
Mm.
literally, it was like 70% off to do IVF.
What?
Yeah. All of your monitoring was covered. The medications were covered. You just had to abide by, some of the guidelines for the clinical trial, and sign like some NDAs and things like that. So we talked about it and we're like, all right, let's give it another shot. We had 2 field transfers. Let's just try. I mean, this has to be a sign. This has to be a sign that he called. And so I'm like, let's do it.
Yeah.
So again, my hopes like literally set up to here. I'm like, this is gonna work. Like this is totally gonna work. It's a sign. We're going all in.
Right.
So we started the clinical trial process, and from that egg retrieval, we did a full egg retrieval. From that egg retrieval, we ended up having again 2 embryos that made it to blastocyst.
So was the protocol any different from the first one?
So it was similar type medications, but they wouldn't tell me. If you've ever been in a clinical trial, it's really strange because they have to do this was like a double blind clinical trial. So the healthcare providers and myself didn't know if we are going to receive the placebo medication or the clinical trial medication. So they
Gotcha.
won't they won't tell you what the medication is. All they could tell you was that it works similar to Follistim and Menopur, which is what I was
Okay.
on for my first retrieval. It was in
So
the same.
do you after everything's said and done, do you still not know what you got?
No, I have no idea. I have no
Wow.
idea what it was.
Wow.
Yeah. But they said they had a lot of success with it. But we went through it and had similar results to our first egg retrieval where we only had 2 embryos then.
Okay.
So, and our embryo quality, I should say that we've never had an A quality embryo until my son was born. So
Okay.
I can go into that later. But most of
Okay.
our embryo qualities were either B's or C's, or a
Okay.
combination of both B's and C's. So again, we ended up getting 2 embryos from that second retrieval, and they were both, one was a BB and one was a BC quality.
Do you remember the number? Like if it was a 4 or 5?
Um, I want to say they were 5s. I'm pretty
Okay.
sure that they were both 5s.
Okay.
So we transferred, and there was no genetic testing that you could do with this clinical trial, because at that point I said that I wanted to do genetic testing because I felt like we were producing a lot of genetically abnormal embryos, and they wouldn't let us do it as part of the
Mhm.
clinical trial. But
Okay.
the rates were so discounted, we said, let's just give it a shot and see. And we only had 2. So we had every intention on transferring those 2 embryos. But they transferred 1 part of the clinical trial. They would only let us transfer 1. So we transferred one of those embryos. And again, like not even a hint of sticking.
Mm.
There was nothing. Stark white negative pregnancy test. And I'm like a Pionistic addict. I'll tell you, like, I mean, literally, I'll test like 2 days after transfer, even though I know there's no way that I would even get a positive, but I
'Cause you
still
wanna
do it.
see, you wanna see, okay,
Yeah.
the possibility, and you wanna see it gradually move.
Yeah, exactly.
Yeah.
Exactly. So went through that, and another disappointment, another
Mm.
negative. And Again, my husband and I were at a crossroads where, we said, do we go back to fostering? Or at this point, I was leaning towards getting a second opinion because at this point I
Mhm.
had started doing my own research so I could be my own advocate. And I wish that I would have done that sooner. But I come across, your channel, Rochelle and Justin and Phil and Alex and
Yeah.
Tim and Celeste, like all of the big YouTube influencers. So I had stumbled across all of your channels and I started realizing that there are other options and you're
Mhm.
not stuck with one reproductive endocrinologist. Like you should really interview several and visit other clinics and ask like details about their success rates and their labs and what their procedures are and what their protocols are and find that right fit. um, and I wish I would have done that sooner. So, my husband and I, we started doing our own research and we found another fertility clinic, Shady Grove Fertility. I will drop their name because that is how I have my son today. Um,
Awesome.
so I scheduled an appointment and I said, you know what? I knew that we had one embryo that was still frozen, but I just strongly felt that that embryo was probably genetically abnormal. It was a C quality. I think it was like a CC. It was a pretty poor quality. Not saying that you can't get pregnant with C grade embryos, but for me, I just wanted to explore another option. So
Yeah.
made an appointment with Shady Grove, and the second that I met my reproductive endocrinologist, like I knew that she was the best fit for me. She
Cool.
really, her name was Dr. Schumacher. If anyone's in, Pennsylvania, Chesterbrook, Pennsylvania,
Cool.
she listened to everything that I had to say, and I literally recapped my whole, at that point, it was, a 13-year journey. I had recapped it all from start to finish. And she said, wow, you've really been through a lot.
Mm.
um, but she listened to me and she didn't dismiss me when I said, hey, I read about this protocol or I heard about this protocol. What do you think about that? Do you think we can try that? And she was willing to always listen and try new things. So I really
That's
like that.
so good.
The plan was really individualized. It wasn't like my old clinic where I felt like I was literally just a number to them. It was like a baby factory. I mean, there were just so many patients, like you're just like in and out, and I literally felt like a number. Nothing was customized to me.
I've heard that so many times.
Yeah.
And it's not like, I'm sure, like with me, I can think of a couple of girls who have gotten pregnant at the facility that I first went to. But man, my gut was like, this is not working. And, cycle after cycle after cycle, and things aren't working. And I'm still feeling like I'm a number.
Yeah.
That's when it's like, okay, I'm the dumb one. I need to be the one to say, okay, that's it. I'm going somewhere else. So yeah, it's amazing how many fertility clinics there are that, run their facility like that.
Yeah, 100% agree. And it's like a
Mhm.
totally different ball game. And it just
Yeah,
rejuvenates you too. Like when you feel like you found that right fit, it gives you like this new, sense of hope. So
totally.
yeah. Um, so I asked a lot of questions about their lab. They had really great success rates. And she developed, she got all of my medical records from my last RE and she developed a personalized care plan like just for me. And I pretty quickly started going through the process again. We needed to do another egg retrieval. She had repeated some of the same tests just because, for that control factor, she just wanted to make sure that everything was lining up with what they had done prior.
Mhm.
So went through the whole gamut again, all of the blood tests to rule out, metabolic causes, any other kind of cause for infertility. Again, everything essentially was coming back negative. They did find that I had a slight thyroid imbalance. My vitamin D was slightly low. Those were the two things that they had found initially. So she had put me on
Okay.
a thyroid supplement and a vitamin D supplement. That's what we had tried first. And then I went through my egg retrieval and I only had I think it was 9 eggs for that last egg retrieval. But to my surprise, 7 of them fertilized.
Wow.
All 7 of my embryos made it to blastocyst.
What? Oh
All
my gosh, that's
Yeah.
amazing.
From fertilization, it was 100% success rate. All 7 made it.
Now, okay, so the protocol, was that different? The different medications?
So they had me on it was very similar. I was on the
Okay,
Follistim, I was on the Menopur. Um, I did before I had started, I did like a course of Lupron. I'm trying to remember. I think it was maybe like 30 days I did the Lupron.
okay.
And then it was the Follistim and the Menopur.
Now
But
remind me, I'm sorry, the Lupron, is that for egg quality? I don't remember.
that is to basically like shut down your cycle. It works like a birth control. So it
Okay,
basically like just shuts down your cycle. So that way
gotcha.
they can start fresh. But I will tell you that she like doubled my medications right off the bat because I had such limited embryos that made it to blastocyst for my prior 2 retrievals. So she had actually doubled my medications like right off the bat.
Okay,
But it was the same medications. It was the Menopur and the Follistim,
just more.
just more. Yep.
Okay,
Um, so yeah, so we had 7 blastocysts, and she definitely like encouraged us to do the genetic testing. So we sent our 7 frosties off for genetic testing, and we had 2 out of the 7 that had come back genetically normal. Now for
how
my
fascinating. How
Yeah,
fascinating, because, you weren't that much older than the first couple of times,
right,
right?
mhm,
And that reproductive endocrinologist was kind of just, you know, was like, "Oh, it's not that important." But she
exactly.
thought it was.
Yep, she absolutely thought it was. And
Okay.
she was right because 2 out of 7 for my age bracket is really low. I should have
Okay.
had at least 40 to 50%. So to only have 2, I probably should have been more like the 3, to 4 mark. So I had 2 that came back genetically normal.
Okay.
So for some reason, we just make a lot of genetically abnormal embryos.
Gotcha.
Um, yeah. So I was really hopeful that we had to. And again, I set my hopes up really high. And I'm like, okay, this is the first time we did genetic testing. Like, this has to work. Like, we have 2 embryos. And we knew the gender. So then, of course, my mind starts going, like, oh, my children, like, this is what they're going to be like. And,
Yeah.
so we had 2 boys. I knew that we had 2 boys,
Okay.
and we did our first embryo transfer November of last year, and I ended up getting a positive pregnancy test, and I was like in shock. I was
Because this
shaking.
is your first
My
one.
first ever in 13 years. I had never
Wow.
gotten a positive pregnancy test. I was like in shock. I was shaking. I was crying. I was like so excited. And then it was just kind of downhill from there.
Mm.
I started, like I said, I'm a pianistic addict, so I was testing like twice a day. I wanted to see that line get darker, but unfortunately it went the opposite direction, and
Mhm.
it just kept getting lighter and lighter. And I went in for my beta test, and it was like, I think it was like 3 or 5 at that
Oh, wow.
point. So I ended up having a chemical pregnancy, early miscarriage, whatever you want to call it. And I was like probably at one of my lowest points in my infertility journey because, again, you just get so rejuvenated and you get your hopes up and you think this has to work.
Yeah.
You try one new medication, you try one new protocol, you try a different doctor, and you think that, that like this has to be the time. And it wasn't.
Mm.
I was so used to getting negative pregnancy tests throughout my 13 years, but I never prepared myself for getting pregnant and then having a miscarriage. Like, that thought never even crossed my mind. Like, I thought if I could just get
Sure.
pregnant, like, I'll stay pregnant.
Right.
So that was a huge
So
blow.
I bet it was. So at that point, being a believer, how did that shake your faith?
It did. Yeah, it did, for like a half a second. But I knew that, I had to quickly remind myself that God did not take me this far and put me through all of this to not fulfill the desires of my heart. Like he's not a God that does that. So I
Right.
knew that there was something else in store. And once you start like having faith and you become a believer and you start really leaning on him, um, it gives you the motivation to keep going because now you know that there is this grand plan for your life that you don't see it, but God already knows it and he knows what it is. So you just have to keep running the race and keep going through it until you figure out what the plan is.
I I agree. I
Yeah.
totally agree.
Yeah. Yeah. So, I wiped my tears and I got back on the horse and we had one embryo left and he was our day 7. A lot of clinics don't let embryos go to day 7.
Wow.
Yeah.
I think that's
So
so important that you say that because that's gonna be great for other people to hear.
yeah. Yeah. So he did not develop until he was on day 7. I remember getting that phone call on day 6, and my embryologist said that you have 6 embryos, but there's one. I'm just going to keep watching for an extra day because I feel like it could turn into a blastocyst. So I don't want to like discount it yet. I'm just going to keep watching it for an extra day. And
Mm,
sure enough, on day 7, he developed into a blastocyst. And
incredible.
yeah, absolutely incredible. So he was my number 7 embryo, developed on day 7.
Wow.
So we did that transfer then a month later, and it took and he stuck with us, for the long haul. So, like I said,
Mm.
most clinics, they don't let those embryos go to day 7. And a lot of women are discouraged because clinics will transfer day 5s before they transfer day 7, even though my son, he was an AB embryo. The embryo that I had miscarried right before him was a day 5 BB. So because he developed on day 5, they had decided to transfer that one first. Um,
Okay.
but my day 7, he was my last embryo, and like I said, even though he was a little bit better quality because he didn't develop until day 7, they transfer that one later.
So at this point, you transfer your last embryo, you and your husband, did you guys talk about, okay, we're just not sure after this? Or, what kind of conversations were you having?
Well, he was, I mean, before I even, gave birth to our son, he was ready for another one. Um, so,
And you're like, hold on.
yeah. Um, so we've started trying again. So I'm right back on the infertility journey again, because I am going to be 34 tomorrow. And,
Mhm.
like I just feel like, as you get older, my egg quality, is already not the greatest. So we just really want to try sooner than later. So we started trying again. We want, as many as God will let us. I don't know about going through fertility treatments again. I'm not sure. I definitely will be going back to Shady Grove if we do, for sure. But
Yeah.
it's just like mentally it's exhausting, physically it's exhausting. I still have a lot of infertility trauma that I dealt with my whole pregnancy. I'm even still dealing with it now that my son's here. I'm just waiting for that next bad thing to happen.
Yeah.
And it's a hard mindset to break when you go through. I mean, infertility trauma is a real thing. It absolutely is a real thing. And it's something that I still continue to struggle with. I had terrible anxiety throughout my whole pregnancy. And it's a misconception that if you go through infertility, you get pregnant and all of that goes away, and it doesn't. It's still, it will be with me forever. Infertility will never be lost on me. It will always be there.
Yeah. I mean, I know what you mean. It's like for me, I never got pregnant before I got pregnant, and I had no reason to believe that anything would go wrong. But man, those thoughts just overwhelmed me at times. So I
Hmm.
totally get it.
Yeah.
Yeah. So tell me, when your son was born?
He was born in September. So yeah,
September.
on the 25th of this month, he'll be 3 months old. So
Oh my goodness. Congratulations.
thank you.
That's just what a treasure. It's amazing. Motherhood. How is that for you?
It's great. Honestly, like we've been so
Yeah.
blessed because he's like literally the perfect baby. Like he's already, I
Good.
mean, he's sleeping 12 hours through the night
Oh,
already.
that's amazing.
Yeah, he's so good. Like he's not fussy at all. He'll only cry when he is wet or he, needs to be fed, but we seriously just got so lucky.
Wow.
But I will tell you that literally the second I laid eyes on him, it's like I forgot about all of like the pain and the suffering and the years of wanting him and waiting. Like literally when they say you were worth it, it's totally true. It is totally true.
Yeah.
As soon as you lay eyes on that baby, it's like I do it 10 times over. I do it 10
It's
times
true. It's true. I mean, the money, everything, the
over.
tears. I mean, it's so, so true. And it's like in the heat of it all though, you feel it so hard, right? And like you said, you went through some dark times, but then once you get over that, it's like, wow, it just seems so far away at times. So,
Yes.
yeah,
Yeah,
I
completely.
totally get it. So looking back, at the beginning, before you started to go ahead and just kind of dive into this infertility, all the infertility treatments, um, you kind of touched on it a little bit earlier, but I kind of want to go over it again. What would you have told your younger self, before going into all of that?
I would say be patient. Don't set the expectation too high that, it's going to work the first time, and be your own advocate. Don't just jump at the first RE. Um, really take your time. I wish that I would have had, these YouTube channels and this infertility community that I, found years later, but really just advocate for yourself and get help sooner. Like I wish that I would have gotten help sooner. Not that it would have prevented, my hardships and everything that I went through. But I feel like I may have, gotten some answers sooner.
Yeah.
But yeah, really just being your own advocate is really
For
important.
sure. For
Yeah.
sure. And then also for others who are about to start their journey and they're watching this, is there anything differently that you would tell them? Maybe from an emotional support standpoint, maybe like what helped you, what hurt you along the way, maybe telling people around you what you were going through,
Yeah,
anything
that's
like that.
That's what I would say. Like I would say like don't hold it in. Don't bottle it up. Don't be
Mm,
ashamed of infertility. I went through that period too where I felt like, I'm a woman and I can't even like birth a child, and that's, I feel like I was set on this earth to do that. I had that, that strong desire to want to be a mom, and
yeah.
now here I am, like my body is failing me and I can't even do that. And I had a lot of shame, at one point that came with that. And initially I didn't really open up about my infertility journey. And that really hurt me. I
Yeah.
didn't know how to cope with infertility. I didn't know how to manage those feelings. So I would say to anyone going through this, find a good support system, whether that be, through this infertility community, through these, YouTube channels, or, personal friends and family. Just find a support system, because I'll tell you, there's more people going through infertility than what you think. You think that you're the
Totally.
only one, you feel like you're the only one. And then once I started opening up and really telling people, oh yeah, I know this person, or I know that person, or I went through it myself. So just, I would say just try to tell as many people who will listen. So that way you always have an outlet or an avenue to vent and get suggestions from, get advice. You don't have to go through it alone.
Totally, totally. Wow. I am so excited, and thank you so much again for just telling me and us your story.
Yeah, it was
Where
a
can
pleasure.
yeah, where can people find you?
Kelly_RN_ IVF warrior. So that is
Cool.
my Instagram. So feel free to follow me on there. You'll see lots of updates of my little guy. And like I said, I do talk about, still my infertility journey and just kind of life updates in general.
Awesome. Well, gosh, I never know. I know just a little bit, sometimes you let me know, people who hit me up, just a
Yeah.
little bit about your story, but to be able to walk through it is just a whole nother thing. So, yeah, thanks again for being vulnerable and transparent about your journey.
Yeah, absolutely. It was so nice meeting you.
So nice meeting you too.